Welcome and thank you for joining me today. This poster presentation is titled A Novel Pathway to Diagnosis of Hypermobile Spectrum Disorders and Hypermobile Ehlers-Danlos Syndrome through empowering patients with an online self-screening tool. It was developed by Hypermobility Health Connect co-founders Pauline Slater, myself, Martin Scicluna and Anne Chu. I am a clinician and researcher based in Adelaide, South Australia. I work both nationally and internationally in the Ehlers-Danlos and Hypermobility syndromes spaces, along with their comorbidities. The project we're presenting today aims to develop and evaluate an online self-screening tool designed to identify hypermobility-related features and symptoms, supporting individuals in accessing appropriate diagnostic pathways for hEDS and HSD. The background to this project involved us recognising very clearly that obtaining a diagnosis for hEDS and HSD is often prolonged and challenging, constantly being named an odyssey or a journey. Research shows that on average time to diagnosis is 15 years internationally and up to 10 years in Australia, or over 10 years in Australia. During this time, patients frequently experience multiple misdiagnoses, delayed recognition of their symptoms, invalidation, and barriers to appropriate care. Early identification and management, we know, are crucial for improving quality of life and reducing the burden of these conditions on patients. The self-screening tool for hypermobility, also called the SSTH, has been developed to address this diagnostic delay and the issues during this journey. It is an online self-screening tool to help identify hypermobility-related features and at-risk individuals and allow them to access appropriate diagnostic pathways and care. The SSTH uses software automation and branching logic to provide personalised summary reports for individuals. It's designed to empower the individual with self-understanding of their symptoms and/or conditions and support self-advocacy. It is by no means a diagnostic tool. It is a screening tool that encourages conversations between individuals and their healthcare practitioners. The tool is based on validated frameworks and research, including the Baton score, the historical Brighton for generalised joint hypermobility, the 2017 International Classification for EDS and hEDS diagnostic criteria, and features of the Bristol Impact for Hypermobility score and the SPIDER tool, developed by Shay Palmer and Jane Simmons, respectively. The methods utilised in this project involved the developing of a multi-stepped, user-focused design process through online screening. The tool developed required us to review content and create validated criteria using the current literature and criteria, develop a branching logic system, dynamically tailored questions based on responses to those criteria and lists, and then an automated reporting system generating personalised summaries highlighting risk factors and symptom patterns for probable or potential diagnosis. We pilot tested the self-screening tool with 10 participants to evaluate its accessibility, clarity, cultural sensitivity, and comfort. Structured feedback was created and generated from that pilot, and refinements were made to the self-screening tool in terms of question phrasing and user interface to encourage clinical accuracy and ease of use. The final trial was released in August 2025, and we wanted to ensure that it was relevant for the population at hand, and it was accessible to all age groups and demographics, and covered a wide range of individuals of genders and age groups. We also wanted to assess the ease of use of this test. In our findings, 600 participants provided consent and completed the tool over those 31 days. Participants aged in range from 6 to 73 years old, with a median age of 35. Participants needed to provide a validated age and/or adult supervision during the process of undergoing the screening. The gender representation within the process and the project was 91% female, 3.5% male, 3.2% non-binary, and 1.1% identifying as gender diverse or self-described, with 0.7% preferring not to say. This overall reflects what is often seen in clinical practice and internationally in the literature in terms of the gender spread. Additionally, within the findings, 87% of participants reported that the SSTH was simple and straightforward to complete, indicating a strong potential for the adoption across diverse age groups and populations internationally. In relation to the tool, our thoughts and findings thereafter, the uptake of the tool shows that hypermobility affects people across the lifespan and that people are looking for answers for these symptoms. And those people are often utilising the internet for those answers for their health concerns. The self-screening hypermobility tool is its first of its kind online self-screening tool for hypermobility, HSD and hEDS. This provides a first step for individuals who are seeking answers about their symptoms, and it is a research-based informational tool that will hopefully promote informed conversations between the individuals and their clinicians. The limitations of this project include that it was an exclusively Australian participant cohort with a short data collection of only a month, which may limit its overall generalisation. However, we anticipate releasing this test further afield and collecting much broader data to create better use. In conclusion, and our future directions, we're looking at following up to understand how the test is being used and how to improve it. We'd like to understand how do users engage with their personalised summary reports, why they've actually undertaken the tests, and with their personalised summary reports, how that actually may affect conversations with their clinicians. This in turn, we hope, will provide information for us in relation to how this changes or challenges diagnostic timeframes, treatment pathways, and overall treatment outcomes for the patient. Our future research will expand the sample size, include international participants, and explore the self-screening tool for hypermobility's role in a broader digital health space to improve early detection and management of hEDS and hypermobility-related disorders. Thank you for listening today.